So for my presentation, I wanted to talk about a complex issue that I believe not that many people are aware. And I have firsthand experience when it comes to this issue because I am a broker. I'm a health insurance broker. I help small businesses and individuals with their benefits package. So I have firsthand seen how high healthcare costs affect many people in the United States. The name of my presentation is High Healthcare Costs in the U.S. Understanding Challenges and Exploring Solutions. Introduction. High healthcare costs in the U.S. have caused barriers to accessing care, contribute to financial strain for individuals and families, and pose challenges for businesses providing healthcare benefits to employees. We have an urgent need for comprehensive reforms aimed at improving affordability, accessibility, and efficiency within the healthcare system. Overview of the problem. The problem is that healthcare costs have been steadily rising, outpacing inflation rates, and becoming a burden on individuals, families, and the economy as a whole. High health Importance of addressing high healthcare costs. High healthcare costs not only strain individual finances, but also pose a significant challenge to healthcare's accessibility, quality, and equality, impacting overall societal well-being and economic stability. The purpose of the presentation. My main purpose for this presentation is to give you guys an insight of this complex issue and how bad it's affecting many Americans, to explore its implications on various stakeholders and propose potential strategies and solutions to mitigate its adverse effects and promote a more sustainable and inclusive healthcare system. Some of the factors contributing to high healthcare costs are the aging population. Every year, more Americans are getting close to the age of retirement. The introduction of new innovative healthcare technology. I actually have a picture. The picture that's on the screen, that's a physician performing a laparoscopic surgery. It's a minimally invasive surgery uh, that it's faster recovery, it takes less time, but it costs twice as much. Before any abdominal surgery that you needed to do, they would just cut you open, and now they use laparoscopic surgery. Another factor it is the complexity of the U.S. healthcare system leads to administrative waste in the insurance and provider payment systems. The consolidation of hospitals can lead to a lack of competition or even a monopoly, granting providers the opportunity to increase their prices. Lack of price transparency. That's one of the biggest ones that I believe. Lack of price transparency in the healthcare system. You can walk into an emergency room and get a bill later on that could be in the thousands. So not knowing how much the services cost upfront really hurts many Americans. Some of the consequences of high healthcare costs are financial burden on patients. Uh, High healthcare costs create a substantial financial burden on patients, often leading to medical deaths. Another consequence varies to accessing care. High healthcare costs acts as a significant barrier to accessing essential medical services. If Americans can afford it, they will not go to the doctor. It also has an impact on health quality. High healthcare costs can undermine the quality of care provider. This is especially in areas that have high poverty levels. Um, they will those clinics in those areas, they don't have the right equipment to properly diagnose individuals, which leads to many diseases going undiagnosed. And another consequence is affects some businesses and the economy. High healthcare costs burden businesses with high insurance premiums and decreased productivity due to employee illness. As I mentioned, I'm a broker, so high medical insurance is the second highest expense that many businesses have. And there's a lot of employers that are actually dropping health insurance because it's gotten so expensive to the point they can't even afford it to offer to their employees. And so if they don't offer health insurance to their employees, then the employees are left with having no insurance. So I wanted to share some statistics on how high healthcare costs affect the U.S. 66.5% of bankruptcies in the U.S. Um, are due to medical debts. So we can see the amount of Americans filing bankruptcy because of this. It's pretty high. Another statistic, 56 of insured Americans have medical debts compared to 59 on uninsured Americans. So we can see, even if we have medical insurance in the US, that doesn't mean you're not going to have medical debt. The difference between uninsured and insured that have medical debt, it's only 3%. 48 of adults with medical debt use up all or most of their savings to pay it off. 46 of Americans are delaying buying homes due to medical debts. Approximately 41 Americans forwent visits to the emergency room due to costs. 2.7 million Americans reported having a loved one die after avoiding healthcare treatment. So we can see millions of Americans are dying every year because they may have an accident and they have a concussion, but they know that bill is going to be so high if they go to emergency, so they simply don't go and they die. Or they might be having chest pains. They think it's nothing. I will going to the doctor because they don't want to get that $15,000 bill, and they might have a heart attack and end up dying. This is a reality that's happening in the United States. There are some disparities in the healthcare. There are certain demographic that is mainly affected about the high healthcare costs, and those are Black people and other minorities, low-income adults, the uninsured, people with chronic diseases or disabilities, and people 65 and older. The United States, it's one of the main. United States, it's a rich country. It's one of the best countries in the world. However, the United States has the highest and the worst healthcare system out of many countries. And this is one of the facts that tells you how bad it is. So I got this statistic from the CDC website that says nearly half of US deaths can be prevented. Every year, 900,000, almost a million, 900,000 Americans die before their time. Nearly all of these premature deaths, dying before the age of 40, are instances of lives being cut short, which were preventable. Many of these deaths were due to heart attack, cancer, and preventable diseases. All these all these deaths could have been avoided simply if they had gone to get a physical. Simply when they were sick, if they had just gone to the doctor. As we saw in the previous slide, millions of Americans refuse to go to the doctor because they don't wanna, they don't want that high bill, but they are dying. Some solutions and policy proposals that I think um, that I got from this website, how to solve the coaching crisis in the healthcare, would be one, healthcare reform initiatives. Governments and policymakers should create comprehensive healthcare reform initiatives aimed at addressing systemic issues, improving access, and controlling costs to create a more sustainable healthcare system for all. Prescription drug price regulation. Implementing regulations to control and reduce the skyrocketing prices of prescription drugs is essential to alleviate financial burdens on patients, improve medication adherence, and ensure equitable access to life-saving treatments. Enhancing price transparency. Increasing transparency in pricing empowers consumers to make informed decisions, foster competition among providers, and ultimately drives down costs while improving the overall quality and efficiency of care delivery. Investing in another possible solution, it is investing in preventive care. Prioritizing investments in preventative care ini- initiatives not only reduce the instances of costly chronic diseases, but also promotes lifestyles that lower healthcare spending in the long run and enhances overall population health outcomes. And pretty much to kind of end my presentation, I wanted to share this quote that I got from this website, and it says, "Basic healthcare is a human right. How how can a country as rich as ours stand by while people are dying?" We And my conclusion is the devastating impact of high healthcare costs cannot be overstated, as it not only contributes to the premature deaths of millions of Americans, but also prevents countless others from accessing the care they need for a better quality of life. Urgent healthcare reform is imperative to address this crisis and ensure that healthcare becomes a fundamental right accessible to all, fostering a healthier, more equitable society for generations to come. Thank you.